Hello and welcome to Ascendant Hope. We are very delighted to come into your space today and just talk to you and bring you stories of hope and encouragement and of people that have journeyed with God and in life, and their stories we are hoping that will be able to encourage you and give you hope that irrespective of where you are today, it is possible to lift up your head and rise up in new hope and in new strength. I am your host, Christine Kamau, and I have my co-host here with me today,
Eva Njawini. Welcome once more to Ascendant Hope. As Christine has said, we enjoy sharing with you stories of hope. Recently, we had a guest on our show who was sharing her story about living with depression. And thank you so much for the responses that we have received from you and even the questions that came up regarding depression, how to handle it, how to detect it. And today we are very pleased to have with us on the show Dr. Kendi, as I like to call her, but I'm sure she'll give us more names as she introduces herself, who is a psychiatrist and is going to help us understand the topic of depression even better.
mental health.
So, and mental health, really, not just depression. So Dr. Kendi, welcome. Maybe briefly just tell our viewers who is Dr. Kendi.
Okay. Thank you so much, Christine and Eva, for having me today and on Ascendant Hope. I like the way she made the introduction and said that this is a program for giving people hope. So I'm Dr. Kendi, a consultant psychiatrist based in Thika Town. I have my own private practice called Trinity Wellness Psychiatry Clinic. I also work with Avenue Hospital, Thika, and Thika Level 5 Hospital. So basically that is all about Dr. Kendi. Thank you.
Thank you.
Happy to have you.
Thank you so much.
Yes, it's an absolute pleasure to have you here. And I think as I highlighted earlier, we had a conversation and viewers have generated a lot of interest from that. And mental health really seems to be a subject that we need to expound on. Maybe to start us off, just help us understand what exactly is depression?
Yes. So depression generally is a chronic mental condition. And when I use the word chronic, I know it looks quite huge. But what generally it means is that if somebody is depressed, is that that person is behaving and their way of emotions or expression is out of the normal. So this is somebody who is overly sad. So in terms of mood, you find that people with depression, they present with sadness. You expect that the normal mood is people who are usually happy. They can express themselves well, but a depressed person will all of a sudden become withdrawn, appear sad most times, and other times they will lack interest in activities that were previously exciting or interesting to them. For example, if this is somebody who is used to go to work, you find that they are no longer going to their work stations. Or for example, maybe somebody who is used maybe to going out with friends, they are no longer interested in all that stuff. They just want to be alone, what we call now social withdrawal. Yes, so basically that is depression. At times also people with depression, they present with a sense of hopelessness and sort of like worthlessness. They don't love themselves, and sometimes also they reach a place where they are suicidal, wanting maybe to end their lives. So basically that is depression. Yes.
The word mental health, is that a blanket word that under there you have depression, you have this, or is depression the same as when we say somebody is depressed, or when we say somebody is going or has mental illness, are they automatically depressed?
No. So mental illness is a bigger, is just the larger name. Of course, we have a number of mental illnesses, not only depression. Yes.
Okay.
Yes.
What else would be under mental health?
So we also have anxiety-related disorders. Yes. We also have psychotic disorders. More so we have schizophrenia, schizoaffective disorder, and also among them now the mood disorders. That's where now we classify depression and now bipolar mood disorder. And also we have now substance-related disorders. Yes.
Okay, Dr. Kendi, I want to take you back just one step, because you started by telling us it's a chronic illness. And I just want you to clarify this to our viewers, because sometimes we just see people moody, we brand them, that's a very moody person, just leave them alone, and we don't develop interest. How important is it for us as a society to actually appreciate depression as an illness? And then how do we get to assist?
So it's important, first of all, to identify depression as an illness first. Sometimes people think that people who are having mental issues, they could be faking it. But of course, nobody can fake being ill. More so now talk of now being depressed. So it is important that we appreciate and avoid also stigmatizing these people who are having maybe or presenting with overly depressive symptoms. And again, I found this sort of like a norm where people tend to categorize everybody who is mentally ill, they are depressed. So how to assist these people is generally take them to the right people. Yes, let them go and get a mental checkup. Of course, sometimes I know they resist. They can also be very defensive. But now if it is from a point of where you want to assist somebody, we have to be very positive, even the words that we are using towards them. So instead of telling somebody that you are not going to work, you are always not feeding well, no, instead of that, you can just tell them that I feel like your condition is worsening since you're always locked up in your room, you're not sleeping enough, or you're not feeding well, so can we go and see a doctor? So maybe probably that approach would be good.
Without necessarily telling them
as opposed,
you are depressed.
Yes. As opposed to saying outrightly that you are depressed.
So you can point to the symptoms.
You can point to the symptoms. So that, because you see now, like if you like just go to them outrightly and just point the symptoms, they are going now to and maybe it's going to make the situation even more worse, and they are going to become defensive. And they might not even want to seek help because already maybe they feel judged, they feel stigmatized and all that. Yes.
All right. At what point as an individual should I decide now I need to rise up and go see a doctor? I mean, how do I tell now, okay, I'm not just stressed because of my work, because of my family, because of my finances. This is something bigger than just some stress. Yes.
So the point that should actually act like an eye-opener to maybe somebody who doesn't even know maybe whether they are depressed or what is happening is if the symptoms they are having is affecting their day-to-day functioning. You're getting? Okay. For example, now I'm not able to go to work. I just want to sleep. Yes. If it is maybe a young mother who is nursing a young child, probably they are battling postpartum depression. They don't want even to see their child. They don't want even to breastfeed their child. They just want to sleep, and maybe even thoughts of harming the child. Yes. And if it is not even a nursing mother, any other person, if you feel like you're having these constant thoughts that you want to end your life, that one is something to just tell you that you need to seek help before this thing goes far. The other indicator is if you find yourself also overindulging in drugs, alcohol, weed, and mirror and the rest. So, because most people use now these substances as a way of coping. Rather than confront your issue, you now want to go to these things to help you maybe relax, be able to sleep. So if you find that now you're overindulging more than usual, it is important to seek help early. Yes.
Can other overindulgences, just 1 minute, can other overindulgences, maybe someone doesn't drink, doesn't use drugs, but then they get obsessed with food or something, can that be an indicator?
Yes, it's still an indicator. There are others now will also get obsessed maybe with even social media, just wanting to be just alone and just posting things. Others now will also get obsessed with gambling, yes. I'm looking for that word, yes. So recently I had this young man, he's a family man, who was brought by the wife, who is a nurse. with the concern that any small amount of money that he gets, it goes to betting. You're getting. So that one has run down their businesses, and to the point at which now this particular man now, just any small amount of money he gets, no matter how small, he'll disappear for days. After the money is done, he comes back home, very humble and looking all good. So it's until now they came to us and we just diagnosed him with a gambling disorder. Of course, it's an addiction. Yes. So this overindulgence can mean a lot, not just drugs only. Yes.
Wow. And I'm just listening to you talk, and I'm thinking about how people even get to a place of anxiety. Yes. I've met people who are very anxious, just generally about life, and panicking and stuff like that. Is that still connected to depression?
Yes, I usually say that depression and anxiety, they have a very unique correlation. Let me put it like that. Yes, so most people who have depression, they also tend to present with anxiety-related symptoms. And the opposite is also true. Most people with anxiety-related issues, they also tend to have depressive symptoms. Yes.
For example, what are symptoms of anxiety?
So symptoms of anxiety, generally, maybe somebody will have, you feel your heart is beating faster than usual, what we call palpitations. Yes. Feelings of like breathlessness, like you're losing your breath. Actually, the easiest way to explain an anxiety-related issue is what we call a panic attack, where you feel like you're losing yourself and losing your mind. And most time when these people now go to like general practitioners, they will tend to think that this person is having a heart attack. You're getting, because of the way they've come, very restless, shortness of breath, the heart is raising, palpitation, so the pressure, probably the blood pressure is elevated, pulse is elevated and all that. They are sweating and all that. So eventually now the doctors do their own assessments, they check the heart, check everything, this person is okay. So generally that's what an anxiety-related issue is. Yes, yes.
Maybe just one step back at those dependencies. How do we explain those dependencies? What do they signify? Why would I get hooked to a certain or maybe activity or a certain sport, anything? What do they signify in terms of how I'm processing what I'm dealing with?
So it means that this particular person has poor coping skills. You're getting. So because of whatever they are going through, they are feeling overwhelmed. And probably they do not want to talk to anybody. You're getting. So the only way to express it, to voice it, is now overindulged or become dependent to certain things that are not good for their health. Yes.
Okay. One question I think that came up as this conversation that started on the previous show was ongoing is, what role do childhood traumas have on probably even adults manifesting with depression and other mental health illnesses?
Yes. So these childhood traumas, we usually call them adverse childhood events. So for example, children who have been victims of sexual assault, maybe probably physical assault when they were young, bullying, especially in our schools, that one has become a menace. Yes. So you find that this person now repressed these things as a young person. So now they are adults, they are having maybe families, they are having jobs, but you see that this thing is still affecting them. The memory is there, it doesn't go away. So the easiest way to explain it, I will explain it because I have a patient right now who is admitted in ward, suffering now depression, but it's because of past traumas that she's had. She's currently now has been in an abusive relationship, where now, because she did not get that kind of attention even from her parents, she will end up falling for any person who will show them affection. You're getting. Yes. So in that now it becomes a cycle where now there is that need of having somebody, they want to be affirmed, they want to be loved. And in that way, they make poor choices. You're getting. So that's how now these adverse childhood events now come to affect us later in our adult life. It's not like, it doesn't like always happen the same way for everybody, but I've seen a pattern where you find that when these people now are getting to the prime of their lives, whether now they are supposed to be maybe settling, getting married, they struggle. Maybe when they are doing their university education and all that, they begin struggling from that point. And it is because of those unvoiced things that they have inside them. You're getting, yes.
Oh, wow. So, listening to you, I think what you're saying is that it's important to face things as they come. Like, don't try to pile up issues, because what you're talking about is that someone that went through probably sexual abuse when they were young, if that issue was not dealt with, it has a way of following you. And if it has not been dealt with, even in future, I mean, that's very interesting, that you'll find that that person will get attracted to abusive people. Oh my goodness. Wow. Are there channels where, I don't know, because I'm thinking that there should be a way that people should be sensitized to learn to talk about issues like that. Because sometimes you find, in my line of work, sometimes I talk to people who tell you they were sexually abused by an uncle, by a cousin, they were introduced to pornography, and all these things. And you find somebody's an adult, but they tell you their problems actually started when they were very young. And listening to what Dr. Kendi is saying, it means that there should be, and people should be encouraged that when things happen like that, talk about them. Right from the moment that they happen, otherwise the thing builds up and you find that somebody is an adult or 40 years and the thing is still following.
Actually, Christine, I think the way to summarize this is that we should normalize having those uncomfortable conversations. Yes, with our children. Yes. Because you find that the kind of the patients have been able to handle. You find that probably when they were young, maybe the parents were having a lot of maybe domestic violence and all that. So there were between father and mother. Right. So there was no avenue for them to voice their concerns, because they have grown up knowing that my dad is this evil person. And of course my mom is also going through her own challenges. So how can I add on to her problems? So the child now closes in with their issues. You're getting. So they go to school, they find a way to express themselves. Of course, sometimes which is not a good way. They find some advice, maybe from fellow people, which might not be the right advice. But thank God also for schools these days, I think teachers are also getting enlightened. Of course, I've interacted with a few teachers who have been able to recognize maybe sort of like abnormal behaviors in the students. And they're able to bring them for counseling and all that.
Actually, I was going to come to that because I'm thinking, okay, this child at home has no room for expression, but they'll find themselves in school, they'll find themselves in a church community or something like that. How can the adults around the child, for example, educators in school, be able to identify there's an issue here? What are the key indicators that I need to call for help for this child? Yes.
So key indicators, number one, is a drop in performance. Yes. You find that there's this young student who's been performing very well, then all of a sudden drop. That one should raise an alarm. Is that okay? The other thing is a bad sort of like behavior. People who come in and become very rebellious to school rules, to teachers and all that. Yes. The other thing also for pointing out depression, especially among our adolescents and these younger children, is that they will not present with the normal symptoms that I said, like for example, low mood and maybe lack of interest and all that. Can present with just irritability, anger issues. Yes.
That
is that
someone
okay?
is just angry.
Someone is just angry.
Something's little and they snap.
Something little, they snap. Wow. So those are some of the things that should alert us. And the other thing is substance use. Yes. So you find these young adults who are using bangi, using weed. We call it marijuana. Using marijuana, alcohol, and the rest. Yes.
Now, the educator in school has seen that. You see, the symptoms you're identifying are mostly what the school will call indiscipline, and now come in and institute disciplinary measures against the child.
Punishment.
And that might just as well drive the child up the wall because already they are struggling. So how then, what should be the response of educators? Maybe before when we say, okay, there are disciplinary measures, how do we make sure we can cater probably for emotional, psychosocial needs of the child before we just say, this is disciplinary?
So this is the point now for helping us now have safe spaces where now these students can voice their issues without being victimized. You're getting, like, let the educators now sit down these children and just give them a space, a non-judgmental kind of attitude. Tell me what's happening to you. And I'm telling you, those people are going to narrate issues. You're getting, rather than now the corporal punishment. I think these days there's no corporal punishment in schools, because of course that now tends to worsen the behavior. Actually, if you tend to encourage now that excessive discipline or maybe harassment in schools, it's going to worsen the emotional whatever problems that now these people are having. Yes.
Wow. And talk a bit about stress.
Yes.
Because we all agree that currently, with the way things are, people are very perplexed and stressed, and inflation and a lot of things going on, and broken homes and families and all that. And unknown to people, you find that people are carrying a lot of load. Is there a possibility where somebody moves from being stressed about issues in their lives to a place whereby it now jumps over to a mental illness?
Yes, there's a big possibility. And of course now what now leads to maybe moving from stress to depression is now how we handle that particular stress at that moment. You're getting, because I usually tell people that mental disorders, they have to do with our thoughts, what we are feeding ourselves with. So eventually that one now leads to a certain emotion. You're getting, it's either because of today I think I'm jobless, so the next thing that comes to me now is I'm useless, I can't do anything for myself, so I start hating myself. I start thinking that people even don't love me because maybe for no reason. So all of a sudden maybe I'm now hiding myself. I don't want to socialize with people because I am feeling that something is wrong with me. But if we handled that in a different way, for example, maybe I lost my job, where now you decide, let me just sit down and think through this thing. What else can I do with myself? It doesn't mean that losing the job now demeans me as a person or it's the end of life. So this is where now, if I'm faced with a stressful situation, we have to practice a lot of self-care. You're getting? So self-care is involving my emotional well-being and my physical well-being. So what am I doing? Am I getting enough sleep? If I'm not getting enough sleep, then it's a problem. If I'm not eating well, then it's a problem. If I can't exercise, it's also a problem. If I tend to dwell on what is happening on social media, is also a problem. Because you see like this now, these days now when people are having a lot and you keep checking on social media and all that, it tends also to heighten your stress levels. So if I'm always on social media and it's a trigger for me, of course I'm going to be stressed. In a few weeks, I might be depressed because of what I'm seeing there. Yes. So I'm thinking that we need to practice self-care. The other self-care tips is also avoiding maybe overindulging, because you find that people now who are stressed, Like for example, now I have this patient in the ward who recently discovered the wife was having extramarital affairs. So this person who is a teacher and a well-raised man, all of a sudden now starts drinking because of that issue, and drinks and drinks and drinks to a point where now he does not even appear in school to teach and all that. So it is just some intervention of friends and relatives that he was able to be brought to hospital. So now on being brought to hospital, now we are having now that safe space where he can express himself and voice his concerns. So to cut the long story short is to mean that stress can eventually lead to depression.
You know, consistently you've talked about safe space. Safe space and voice your concerns, which is very crucial. But then we're looking at depression as a result of not having that environment. As you talk about self-care, because I'm dealing with joblessness, my marriage is not working, I am probably dealing with an illness, another physical illness, I have maybe issues with debts and so forth, then at what point do I give, what really is the significance of the associations we have in terms of helping me then be able to voice that? Because I'm thinking that I need you to address that safe space. Where does it come from for me who is feeling that way? Do I have a role in being able to create that for myself so that I can be in self-care? And how do I know this is a safe space for me to voice what I feel so that it doesn't crush me?
Yes. So, of course, sometimes I know there are people who have battled mental issues and they felt like people around them might not understand. But you see, sometimes we just assume that people are going to judge. Some people are going to judge me, or they are going to say bad things if I disclose issues. So if you feel like your associations or the people around you might not be able to help you, that is why even these days, all over social media, I think you can always get help, even online, you see. So this thing of people saying that I can't get help, sometimes I don't understand. You get in. And it is because maybe probably now mental health issues have been really stigmatized. That I wonder why somebody who has maybe a cough or is having diarrhea can easily go to hospital without even thinking about it. But the moment I start lacking sleep, or I start feeling worthless or having suicidal thoughts, I want to hide myself. I just wonder. So that is where now we have to normalize these conversations and say that mental illness is not like a death sentence. You get it? You can always walk into hospital and be assisted. Yes. If at all associations around you or people around you cannot be able to help you. But of course, sometimes it's not good to assume that people around me don't care. It's always good to have that one person or two people that I can always run to. When I'm having issues, I can be able to sit down with them, tell them, this is how I'm feeling. Express your feelings. You get in. And in that way, this person, if they are, of course, enlightened, they are going to understand this person doesn't need me. I'm not a professional. So I can, of course, assist them. Not professionally, but even accompany them to hospital.
Or even just give them a listening ear.
Just give a listening
ear. Yeah.
Yes.
Wow. Because sometimes you find people that are going through very difficult challenges. Someone, you hear them say, I just want somebody to listen to me. I just want to know that there's somebody that I can talk to and that they will understand me. Yes. And I also like something that you have said. At that point in time, beyond the listening and what have you, if you realize that this is an issue that is beyond you, it's good to refer to professionals. Yes. Because sometimes I think people just quacks, you know, people just want to, yeah, you take this dawa, you'll feel better, you do whatever. Or if somebody finds they're not getting help, I think that's where you're saying now, they revert back to drug abuse. Yes. Or looking for a way of escape, looking for something to pacify them, looking for something like an escape something. Yes. And I think what you're saying, that aspect of, if you do not know, if you come across somebody like that, or you know somebody like that, like Dr. Kendi is saying, I think it would be good, our viewers, that refer them to professionals who can be able to help them. Because I'm listening to the things that Dr. Kendi is talking about here today, and that's not common knowledge that you pick on the road. And that's why we are so grateful that you're here, that you can be able to answer some of these questions. Maybe as we talk about questions, I think the other one that has been there is caregivers for people with mental health. How, because recently I was talking to somebody, and excuse me, they are taking care of someone who's going through that, and it's very stressful for them. I mean, they are sick themselves. They have no mental issue, but just the wariness of this person today, you know, they say this, tomorrow they say this, and really trying to make sense of that. What kind of help can be given to caregivers? Or what approach do they give to?
So first of all, for caregivers, it's important to understand if you're having a mentally ill patient that you've been taking care of, this one can be a lifelong issue.
Oh, really?
Yes, sometimes, depending on the condition that we are talking about. So it's important to appreciate that you also need to take care of yourself. Because this is where now things like caregiver burnout comes in. You get in? Because now you have this mentally ill patient, mentally challenged, who does not maybe probably want to adhere even to the treatment that the doctor is even giving. You get in? So there is also this thing of follow-ups that they have to go see a psychiatrist, see a therapist, and all that. So sometimes that one can become tiring for the caregiver. The other thing that also burdens caregivers is also the monetary implication of mental health. You get in? The drugs that maybe they are buying, they are expensive. So maybe probably this person doesn't even have a medical cover. So they are stretching themselves and all that. So the one important thing to do as a caregiver is always, when you go to doctors or you have a chance to talk to psychologists and all that, voice your feelings. You get in? Your concerns about the patient, what is the issue, and of course from that now you might get some help on how to handle the patient. The other thing also is, now as a caregiver you also need to practice self-care, because if eventually you become sick yourself, how will you take care of this person?
Because your stress
Yes.
end up now.
Yes. And also you have to know your limits. Sometimes you're dealing with an adult who has the capacity to make decisions for themselves. You get in? So just work with the professionals. Don't tire yourself a lot. Yes. And if it is a financial issue, discuss with your psychiatrist or your psychologist. These days even people can access mental health services in government hospitals. You don't have to overstrain yourself going to private practitioners, maybe, if you feel like now you're being overstretched. Sawa sawa. Yes.